Have you ever stopped to consider just how common certain medical conditions are, especially those that might not always be visible? Sometimes, what seems like a rare occurrence is actually a significant part of the global health landscape. It is truly eye-opening. Epilepsy is a perfect example of such a condition. It is remarkably common, affecting approximately 1% of the world's population. To put that into perspective, this means that more than 50 million individuals globally are living with epilepsy. This makes it one of the most prevalent neurological conditions worldwide. This substantial prevalence is not due to a single factor but a combination of reasons. Epilepsy can emerge at any point in a person's life, from infancy through childhood, adolescence, and well into adulthood and older age. In younger individuals, potential causes often include genetic predispositions, which are sometimes inherited, or developmental brain conditions that occur before or shortly after birth. As people age, other factors come into play. These can include previous brain injuries, such as those from accidents or conditions like strokes, which are a leading cause of epilepsy in older adults. Brain infections, certain types of tumors, or even complications from other medical conditions can also lead to the development of epilepsy. Importantly, for a notable portion of people, the precise cause of their epilepsy remains unknown, and these cases are often referred to as idiopathic or cryptogenic epilepsy. This wide spectrum of potential origins contributes significantly to why epilepsy touches so many lives across all demographics and age groups. Understanding just how common epilepsy is has profound implications for all of us. Firstly, it helps to challenge and reduce the misconceptions and stigma that have historically surrounded this condition. Knowing that millions of people worldwide live with epilepsy fosters greater empathy and encourages open conversations. It also highlights the critical importance of public education. Every one of us benefits from learning to recognize the signs of a seizure and knowing how to provide basic first aid safely and calmly. This collective awareness transforms fear into support and helps ensure that individuals experiencing a seizure receive the timely and appropriate care they need from those around them, whether at school, work, or in public spaces. When we talk about epilepsy, it is crucial to understand the clinical definition. It is important to distinguish between experiencing a single seizure and receiving an epilepsy diagnosis. A person is generally diagnosed with epilepsy if they have had 2 or more unprovoked seizures, meaning seizures not caused by a temporary condition like a fever or low blood sugar, that occur more than 24 hours apart. Another diagnostic scenario is having one unprovoked seizure with a high likelihood of having more, based on certain medical findings. This precise distinction is vital for healthcare professionals in determining the most appropriate treatment pathway, which very often includes carefully selected anti-seizure medications designed to manage seizure activity. Furthermore, clinicians often use the term active epilepsy to refer specifically to individuals who have experienced a seizure within the past 5 years and are currently taking medication, or those who have not had a seizure but are still actively managing their condition with medication. The sheer global commonality of epilepsy underscores that it is not an isolated or rare health issue, but a widespread condition that deserves our collective attention and understanding. By embracing this knowledge, we can effectively work towards a world where individuals with epilepsy are met with informed support, reduced discrimination, and access to the resources necessary to live full and thriving lives. Our shared awareness is a powerful tool in fostering inclusive communities and advancing the future of epilepsy care and research.